Doing my dance. Doing my dance. Hey Facebook, it is so good to be hanging out with you guys tonight. Thank you for joining me, first of all, because this is a really big deal. This is so much fun for us. I'm going to start with just a 10, well, that's not going to be 10 seconds. I don't know how to do anything in 10 seconds. 30 seconds of why I love this. When you're a surgeon and you cut somebody's appendix out, you give them a couple of years, they're not going to remember your name. They're going to say, some really nice guy at Sebastian did it, and he saved my life. They're going to say, what's his name? Like, no idea, but he was just a really nice guy with a pink shirt, or whatever this is. Anyway, you get my point. There's joy in surgery, and there's joy in the perfection of surgery. And then there's something more. That is what bariatric surgery is to me, and I know it is to my partner too. Making relationships with people that last for a long time. As you can imagine, somewhere between 73 to 86% of people who come to weight loss surgery are women. Not that I think that men shouldn't be out there doing it more, because we should take care of ourselves better, but a lot of them are women. And a lot of them are young women. And one of the most important things to young women is having a family. So tonight, after I'm done with this miserable presentation, we're going to talk about fertility after weight loss surgery. And I think it's an important talk. I have a guest with me who I'll introduce in a minute, and maybe a couple surprises. So we'll go from there. All right, so let's talk about this PowerPoint. The reason we're going to do this PowerPoint is just from an educational standpoint. Not everybody knows what weight loss surgery is. Some people need a refresher. So let's do this. If you can see the PowerPoint on your screen, and I think you should be able to, but I am not techie, and they're telling me it's on there. So, what are the health risks associated with your weight? This graph doesn't mean anything to me. Everybody can play with numbers and they can make it sound however they want to, but there's one thing that's really hard to make fake or make it look good, and that is trends. All those things listed on the right, diabetes, hypertension, all those things, those are all medical problems, many of them associated with obesity. If you look on the bottom of that graph, that's your BMI. You'll notice you follow it along, and once you get to about 30, all of a sudden those lines, which represent diseases, start trending up. That's undeniable. When your BMI is over 30, you start to have medical problems because your body just cannot compensate for the weight. Don't worry, super skinny people have the same problem. If you go to the other end of that graph, you're going to notice that BMIs under 18 have the same medical problems. Blood pressure, diabetes, depression, joint disease, sleep apnea. It's unbelievable. We try to stay somewhere in that middle, the safe zone. So that's where we talk about the relationship between medical problems and obesity. Obesity has multiple classes. Basically, if you're over 30, you're considered obese. Over 35, it's class 2, you're called morbidly obese. Over 40, you're super morbidly obese. And BMIs, by the way, anybody know what that stands for? Body Mass Index. Take your height, take your weight, do a fancy calculation. It's in meters squared and kilograms, so it sucks for us Americans who don't know how to do that. But don't worry, there's an app for that. I suggest you download it. But it's helpful. It's very helpful. I'm always watching my BMI because BMI is actually very important because all the studies show everything in BMI and how it correlates to your medical problems. There's our practice. The two good-looking people on the right are my partners. It's Barbara and Patrick Dumkowski, Dr. Dumkowski, and I'm the guy folding my arms, and I don't know what that is. I must be compensating for something. I don't know. All right, what are your options for weight loss surgery? The band used to be on there, and it's not anymore. I will tell you that bands kind of went out of style some time ago. I'm not going to poo-poo on the band. There are some patients who do very well with a band. The problem is when we were sold the band, we didn't think about long-term complications, and so that's what we're seeing now. We're seeing some complications with the band. It didn't give us that 60% extra weight loss that we wanted. It gave us more like 30, 35. And that's if you're lucky. But there are some people who can really use that band to hone in on their weight loss. So I'm not going to knock on that. It's just unfortunately not the majority. There's a bypass, there's a sleeve gastrectomy, and there's a duodenal switch. I'm going to leave the duodenal switch out of this talk because it's In my opinion, something that is not necessary for the huge majority of weight loss patients. So we're just not going to go there tonight. All right, what is a gastric bypass? If you think about your stomach as this football, I'm going to take just a notch, a goose egg out of the top of your stomach where your esophagus comes into it. And then I'm going to bypass some bowel and bring it up and plug it into the bottom. What's that do for you? All you need to know is it works in two ways. One, it's restrictive. I can't eat that much. 5 bites maybe, and I'm full because you have a little goose egg of a stomach. Two, it's malabsorptive, meaning if you eat 100 calories, you might absorb 60 of them. So that's how it works in both ways. Don't worry, your body is amazing. It will compensate for all the things that we do to it. So you can't lose weight forever. Your body will compensate for that, but you can keep it off for a long time. That's the beauty of that surgery. We're going to cruise through these because you guys don't need to know this stuff. Here's the amazing part. Every disease state associated with obesity resolves at a rate between 70 and 95%. Like, that's everything. Sleep apnea, 90% resolves after a bypass. Cholesterol, 90% resolves. You'll never take another cholesterol pill in your life. 75% of blood pressure patients resolve. It just keeps going. It just keeps going. It keeps going. Diabetes, 75 to 85% of people completely resolve. These numbers, and again, I'm not knocking on endocrinologists or anybody else, but with the best medications we have and the best diets and the best physical trainers we can put you on for months, if not years, and you can get something like 30 to 35% resolution of your diabetes. You give me an hour in the operating room, I'll give you 85%. And a lot of other benefits. And ask me how safe weight loss surgery is. If you do it in the hands of a fellowship-trained weight loss surgeon, it is safer than taking out your gallbladder. So why wouldn't you consider it? Why wouldn't primary cares point people in that direction? I don't know, but we're going to get to the bottom of that. I think it's becoming more accepted. And by the way, anybody who says it's the easy way out, I don't understand. I don't think I've ever met anybody who raised their hand and volunteered to just go get cut. That is not easy. None of that is easy. It is scary for them. It is anxiety provoking. It's a big deal. So don't ever knock a friend who's thinking about it. You should just prep them up. All right, let's switch, talk about the sleeve for 2 seconds. The sleeve is where you remove about 80-85% of the stomach. Literally that whole outside part that will expand and allow you to eat more, leaving you something that looks like a banana. 5 or 6 bites and you're full. It does not work in 2 ways. It works in 1 way, but it's a really good way. It is restrictive. It restricts you to how much you can eat, which is perfect for many people. It requires a little bit more discipline than a bypass, but the extra bonus, that 10 to 20% better in every category that a bypass is, it's not free. That's malabsorption. So you really need to stay on top of vitamins and nutrition, iron, calcium, these things like that. Nothing in this world is free. If you haven't figured that out, there's your lesson from Dr. Rad today. All right, sleeves, same thing, all those numbers I told you about. In the sleeve, like I told you, it's 10 to 20%, a little bit less advantageous as a bypass, so it's 65 to 85% resolution in all these categories. We're not going to talk about the duodenal switch. I'm not going to talk about complications because that's something you only talk about if you're actually going to go to surgery, but I can tell you the complications are really no different than any other general surgery you're having. Deep vein thrombosis, pulmonary embolisms, infections, they're all under 2%, and they're all the risks of going to sleep on a table and having somebody do surgery on you. The reality, all this stuff is cute. We're going to cruise through it because I want to get to my guest. Oh, here's something. This is actually a cute slide, which I think is ridiculous. I'll skip it. There was a VA study, an amazing VA study, and I just love it. I can't forget it. The VA did a study, and they took something like 600 and something vets. And they said, how many visits do you spend in a hospital or an emergency room or an outpatient setting every year? You would not believe it. These obese vets were going to a doctor 54 times in a year, which is unbelievable, right? But You're like, that's not possible. Oh yeah, it is. Every time you went to the ER, every time you went to the podiatrist for your bad toes or your bad feet or your diabetic neuropathy, oh, and your endocrinologist, oh, and the ophthalmologist for your bad eyes because of hypertension and diabetes, oh, and your primary care physician, oh, and that hypertensive crisis, oh. Every one of those. Super important. So guess how many times they went to the doctor after weight loss surgery? 1 year after surgery. 14. And most of those were post-op visits. So, I don't know. It's just amazing. I just love this stuff. What can I tell you that's special about us other than we are a center of excellence? What does that mean? I really don't like this name, Ms. Bequip. I just really don't like it. Nobody does. It used to just be Center of Excellence, and that's what it should go back to. But it's an accreditation program. What does that mean? That means that if you want to know that you're going to a facility that knows what they're doing, and they're going to treat you like a real person, and they're going to treat you special because you deserve to be treated special, and they know what they're doing, go to a center of excellence. Go to an MBS AQUIP. Why? Well, this chair I'm sitting in can handle nearly 1,000 pounds. Have you ever sat in a chair and wondered if it could hold your weight? That's important. If you don't go to a center of excellence, they're not required to have that. Our gurneys in the emergency room can handle 750 pounds. Why? Because we're a center of excellence. And you shouldn't have to worry about stuff like that. Our OR tables are the same. Our CT scanner can handle up to 500 pounds. Same with our MRI. Again, it's important. It's important. If you're going to do bariatric surgery, do it and do it well. That's my opinion. All right, I think I'm almost done. There's Barbara Allen. She's my buddy, and she's a nurse practitioner who works in our office. She's one of our best assets. She runs the support groups, and she's amazing at it. She also does things like recipes and diet cookbooks for our patients. She's just amazing. So she's a huge asset. We also have post-op nutritional classes, which are, I believe, free, right? Free to our patients, which is huge. Not many people do that. You can get on there and ask as many questions as you want. And you know what? It's free. Go for it. Go nuts. I think it's super duper important. Because you don't want to talk to your doctors. You know, once you're done with me, you're done with me. You want to get information. The nutritionists and dietitians, these are great information. I mean, it's nice to see it all, but... Oh, and this is our congratulations. This is Cheyenne. So I want to say congratulations, Cheyenne, because I don't know if we have a picture of Cheyenne and her mother, but if we do, it'd be great. So this is one of my first mother-daughter duos. And so these guys are fantastic. Couldn't be with us today, but I just want to congratulate her. And I know she doesn't mind because, one, we asked her, and two, she's been posting it on Facebook. She is 4 months pregnant. And so this is Cheyenne's journey. She sent us some pictures, some really cute pictures of her before and afters. And this was one of her dreams. One of her dreams was to be able to have a family. And there's her little bump. So here we are, 4 months along. I know she's proud and her mother's proud, and I'm just so proud of them. And that is the end of my PowerPoint presentation. Now, I'm supposed to introduce you to my guest, but what I'm actually going to do is make her introduce herself. She and I have become very good friends. I would say we're good friends. You know, it's kind of tough because we started off, for those of you who don't know me, I'm a fun, loving guy. I'm also a militant surgeon. So I would say I'm pretty hard on my patients, and I'm definitely hard on my young patients. But I think that at the end of the day, the results speak for themselves. And when I find somebody who's just like driven, so Megan is a driven person. Like if you like, you know, if you, it's one of those things is like Facebook, you know, list one word that describes me. I'm like, driven is it. This is a woman who, like when we met, I started into my, I'm going to push you really hard and blah, 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 blah. She's just like, you don't have to push me. I'll push myself. I'm like, yeah, I got you. And every time it was like, I'll show you. And then she'd come back in for like these post-ops and stuff. And it was like, so Megan, you've lost, wow, 100 pounds. I want 15 more. She goes, what if I give you 20? You know, I'm like, oh, okay. No, sure. And you know, what's funny is she did it. Like she did it. She's crushed it in every way you can crush it. And one of the reasons, we love Megan, but one of the reasons we brought her on too is just because among many, many, many things, she's gone through ups and downs with this. She has figured so many things out for herself, which is wonderful. She lives 6 hours, what is it?
Yeah, 6 hours.
6 hours away from me. So she's utilized just a lot of different tools to kind of figure this out. And she's a young woman. So maybe we'll talk about fertility. I don't know.
Yes.
But, so Megan, do us a favor.
Hi.
Tell us your story, and you can take 10 hours. I don't care.
Let's not take 10 hours.
All right, go for it. Tell us your story.
Okay, so I started out on my very long journey. It's only been a little over a year and a half, almost two. May will be 2 years.
Almost 2 years. May will be 2 years.
Almost 2 years. I've known you for 2 years. I met you in December of 2018.
Not that anybody's counting. I mean,
Nope.
so.
I just like to throw it out there that I've known him for a little bit.
A little bit.
And I'm so happy that it all started off with a seminar. It wasn't online. It was just
Face to face. It was
face to face. Just happened to, let's see who's in the area.
Do you guys remember when we used to do things face to face? Does anybody remember that? Like a handshake?
Oh,
Remember that?
days.
Yeah.
So,
All right.
and I made the decision that night. It was bypass. I came in probably.
You knew right off the bat.
Right off the bat, like you.
Why? Like what?
Went
Just
through your slew of things, and I weighed the benefit of having a bypass rather than a sleeve because I knew I needed more from it. I knew I needed the restriction. I knew I needed absorption. I knew I needed the discipline.
okay.
Because I wasn't emotionally strong in myself at that point.
Okay, I'm going to stop you. How long would you say you thought about weight loss surgery before you even showed up to a seminar?
5 years.
5 years.
Mm-hmm.
That's awesome. So they say that the average is 2 years, but I say that's baloney. People think about that for much longer than that.
Quiet in the dark by themselves.
Right.
Their thoughts haunt them. And it's far beyond just going to a surgeon and talking about it. You talk to your friends first, you talk to your family first. Sometimes you don't. Sometimes people are ashamed and embarrassed and kind of we hone those thoughts and think about them a lot longer than we should have. I sat on it a lot longer than I should have.
Okay, so if you had to do it again, you'd have come sooner.
That's my only regret.
Really?
Not doing it sooner. And people ask me if you could have changed anything, if you could have done anything, what would you have done differently? I would have done it sooner.
So I recently took a trip, and somebody said something to me, and there's 8,000 ways to say it, but they said something to me, and it's so much better when it came out of their mouth. It was something to the effect of stand where your feet are.
Yeah.
And it's like be in the moment. So I would tell you, I think your timing was perfect.
And people have told me that since then.
That's right.
It came in
5 years before may have not been, mentally, physically may have not been right. You stand where you are. You crushed it. All right. So keep going. Keep going.
So that night I made the decision. It was going to be bypassing. I came in and saw you probably 10 days later on my first consultation. You said, "So what do you want to do?" And I said, "I want to be healthy and I want to be happy." And you said, "Well, let's do it.
Let's do that."
Let's do that." And I asked you then what your goal for me was, and you said 185. That's where I would like you.
Well, where were you?
I started at 367.
I know you're not going to believe this out there. So I know you're not going to believe 367 over here. But we're going to post, if you don't mind, we're going to post some pictures of you.
Absolutely.
Because when she's standing up, she's a tall glass of water, and then she makes me feel short. She promised me she'd wear flats today because I'm short, so I'm feeling better. So go ahead, 367.
I did. And the night that we met, you were like, "Aren't you a tall glass of water?" I said, "Well,
yes, it's tall. So 367, and I said 185.
Yeah, you said 185 is average, numbers-wise, is where you would see me at the end of my journey.
Okay.
And I said, okay, I can live with 185.
I can live with.
I can live with 185, yeah, sure. And in my head, I didn't see myself past 220 because I was in my prime in high school, running track, lifting weights, in cheerleading, stacked like a brick house at 220.
At 220?
At 220.
In high school?
In high school.
No kidding.
Yeah.
Okay, so now this is an aside question. I love this because this is where it gets good. This is where it gets it. When we talk about weight loss surgery, we talk about three things. when it comes to your weight? It's like, okay, one, what is the weight where you would have said, it was worth it?
Yeah.
Two, there's a weight where you say, yeah, I'm happy with that. Mm-hmm. And then there's this, like, we call it the dream weight. Like, what's your dream weight? So, all right, what are those three categories? Where would it have been just worth it for you?
Mm-hmm. Worth it would have been 220. I said 220 would have been worth it.
Okay, so for 367 to 220, you would have said, I'm at my high school weight, I'm cool.
Right.
All right, then what would have been the, I'd be happy with that. Would that have been the 185?
185, I'd be happy.
All right.
Yeah.
And are you going to tell us where you are today? Are we at dream weight yet? Where are we at?
Okay, so Barbara Allen, when she first asked me, she said, where do you want to be? And I was like, 135. If I could get to 135, she's like, I was like, that's bottom of the map.
How tall are you?
5'9".
5'9", 135. Hello. All right.
That's a tall glass of water. So she said, you would be, no offense, you would be real thin. You would have, you'd be straight up and down, little lady. And I was like, I know. I could see it. I could see it. But looking at a scale, like the BMI for my height, my weight, 135 to 155 was not unimaginable.
Right.
It's normal. So I got down to 149 at my lowest, and I looked in the mirror and wasn't happy. I was like, I see the number on the scale, but physically looking at myself, I didn't like the way I looked.
Too thin?
Too thin.
Okay, all right.
So I was like, let's start trying to put some muscle on.
Right,
So,
right.
Still at a calorie deficit. I burn about 3,000 a day, and I intake about 1,000 to 1,200.
Not that you're following your numbers.
Not that I'm doing anything like that. But I also, I'm going about 4 miles a day.
That's right. That's right.
I still keep up with my regimen, and I've just put on some more weight in my legs.
Good.
And I'm happy with it.
I'm good with that.
I'm happy with it.
I love that.
Met a cool 160, and she's
a good 160. That's wonderful. I would tell you that's your dream weight, because that's where you feel strong, you look strong.
I feel amazing.
Your hair is so healthy. Your skin is like, you know what I mean. That's where, and anybody walks into a room, they'd be like, "Dude, what'd you do?" And you'd be like,
come here, let me tell you all about it.
Let me tell you about
it. Let me tell you about my surgeon. Come here, let me tell you.
Okay, so I know we got off on a tangent. I'm so sorry.
Guys.
Okay, so.
But that's me.
Okay, so you had surgery.
Mm-hmm.
Was it tough? I mean, what was it like?
Surgery wasn't bad. I had this amazing surgeon. I should probably tell you about him.
I heard he's a great guy.
Nice guy in a really pink shirt, but hey. Surgery wasn't bad. I remember coming out of it and it being like, oh wow, you were just knocked out. But it wasn't unimaginably painful. It was like, someone just, cut you open.
I had surgery. Yeah,
I had surgery. My gallbladder was worse coming out.
Thank you. Worse than a gallbladder.
It was
not worse.
Not worse than a gallbladder.
That's important. I think people should know that. It's laparoscopic these days. It's little holes for the most part.
It was.
Big surgery, little holes.
Yeah. And I woke up and was up and walking.
Were you starving?
No.
No, it wasn't hungry.
And people I've told and mentored along the way, you're gonna have head hunger about a week later. It's gonna hit you like, I need to eat something.
I've never heard that term. I like that term. What does that mean?
It's only head
It's
hunger.
just in your mind?
Yeah, because you're on a regimen daily of breakfast, lunch, dinner, snacks. It's head hunger. You think that you have to eat something. Your body is not craving anything. Your receptors to your brain have cut off and said, we're not hungry.
I like that. Head hunger. I might steal that. I'm just going to say right now. It's
all head hunger. It's psychological and emotional still. And people don't realize that's the hardest part coming out of surgery. It's not the surgery. It's not the physical aspect of it. It's not the restriction. Trust me, it can get a little painful with water sometimes.
Yeah.
If you got a dry pouch. But it's not the physical aspect that hurts the worst. It's the emotional eating that you can't do afterwards.
Now, would you say you miss food?
Absolutely not.
Emotionally?
Mm-mm.
Okay, so
I don't.
So food was never your addiction?
No.
How did you get to 367?
That's another story, which ties into our story.
Okay, all right, go ahead, come on.
I had my child, which is now 14.
Okay, so how old were you when you had...
17.
Okay.
I was told at 15 that I would never have children because I had PCOS. I was overweight then. I wasn't developing follicles and releasing eggs like I should have been. I was only cysting up, and I'd had 2 cyst removals at 15.
I'm so glad you said that. I have so many young women who come in and they are like, you know, streaming tears. I was told I would never be able to have babies. I have PCOS. I'm not even sure what this is, but they're telling me I have these big cysts on my ovaries and I'll never have babies and da-da-da. And I always say, you have weight loss surgery and me, you get on birth control. And they're like, no, I can't have babies. And I'm like,
oh, but honey, you can.
Yeah. All right. So you were told you couldn't have babies.
Yep.
Now you're 15. So now you're 17.
Fixing to turn 18, got pregnant, and was like, well, this is my shot. And they're telling me I'm never going to have a kid. I'm having a kid.
That's right. That's right.
So I had my baby, and it was the best thing I've ever done in life, but next to getting married and having gastric bypass.
We'll take third place.
Right.
Fine. We're good with that.
And I, lost my father at 19 and was raising a child on my own and dealing with life and 2 jobs and packing on a weight and emotional eating and stressful eating, and kind of ballooned up to about 300, and I stayed there. After my child I got back down to about 240. After my father passed away, I sat at about 300 for years.
Okay.
Met my husband. I've known him since 2002. We were, kids, young, lived in separate cities. He actually lived here in Port St. Lucie. I lived all the way in Pensacola, 8 hours away.
That's some distance.
Right? So we finally met face to face in 2016, and he said, I absolutely love you. I've loved you for the longest time. I'm so glad I got to meet you in person. So it was an online relationship for many years. He had went off, got married, got a divorce,
This is like we got a movie write this.
Right? Somebody pick me up, hey.
Okay. So he moves his hiney to Tallahassee?
No, I moved down here, opened the resort, and he proposed within 6 months of me moving down. We got married 4 months later and said, let's have a kid. And I couldn't have a kid. So we had tried for about a year, and we said, okay, we need fertility medication. And that's how I ballooned up to about 330.
Right.
I was like 331 when I found out that I was pregnant. Got pregnant with triplets. Boy, we were excited. And I was like, oh, this is it. This is our time. I can't believe it. This is great. About 16 weeks later, I had a placental abruption and lost our triplets. So that is what triggered I should probably lose the weight. Like, my fertility specialist said, I can only do so much, but the weight is hindering.
That's what's holding us back.
Yeah, that's you've got to get the weight off. And if you want to do it right. I said, okay. And I had yo-yo dieted, cabbage this, Atkins that. Just over plethora of years trying to, maintain. And so that's how I found you. I said, I'm done. I can't do this anymore.
All right, so I'm going to put your husband on the spot. Was he supportive of this decision?
Yeah, absolutely, 100%. So I called him on the way home from that seminar, and he said, how'd it go? I said, I'm having gastric bypass surgery. He said, do it.
Done.
I got you. And I was like, even if I have to take off work? And he goes, I've got us.
I need that t-shirt. I need that t-shirt. I got you, boo.
I got you,
boo. I got you, boo.
He would never call me boo.
Well,
I got you, babe.
Maggie Poo.
That's my dad.
Oh.
Yeah.
Yeah, I'm a dad. I get it.
I know.
All right, let's do a time check. How are we doing on time? Because I want to get to some things. 30, we're good. So we're rolling. We're good.
Plenty.
Okay. So, wow, this is a great story.
I know,
okay.
right?
So then we do the surgery, which you've kind of hit on. You did great. It wasn't that bad. You rolled through it. You set up your goals, you knock them down. You set up your goals, you knock them down.
I did.
And you just kept rolling.
Yep. At 6 months, I came back to you at 185.
Yes, you did. That's amazing.
No. 6 months was 260. A year was 185. I met my 1 year goal at 185.
And it's funny you say that too, because people are like, "Oh, I hit my 1 year, I'm done." I'm like, "You're not done.
You're not done.
You got 18 months.
Mm-hmm.
Get it. get you some. And you can have more than that. So this is what's great about you too, because you just set it up. You set it up so perfectly.
I tried.
Maybe that's why you're on the show. But
Hi.
So weight loss is interesting. It's this kind of bell-shaped curve, right? And we always tell people with a gastric bypass, you will lose theoretically 70 to 80% of your excess weight, right?
Yeah.
And the problem is that's the 50 percentile.
Yeah.
So let's run your numbers. Let's say 370 just for like a kind of a number.
Yeah.
370, and then let's say the BMI chart says 140.
Yeah.
150, whatever, 150. So we're looking at 220 pounds, 230 pounds of extra weight. Mm-hmm. So when we say you're going to lose 80% of your excess weight, we're talking about, for you, it was like, 160, 170 pounds. Mm-hmm. How much have you lost?
More than that.
Let's do some math.
More than that.
More than that.
Yeah.
So you...
200 plus.
Yeah, exactly. 160, 170. You're at 220, 210, 220. That's the beauty. It's a 50%. The bell-shaped curve says the 50% line. Now, you can be on the wrong side of that, right? You can lose 30 or 40% of your excess weight. Or you can lose 100% of your excess weight. You can gauge that. It's really where you're going, right? It's where you put it in. What I love about the bypass is that it is easier to keep that weight off. In theory, you should only gain, and anyone else should only gain 10% of their weight back in 10 years. Yeah. Right? So you're talking about, all right, well, if by the time you're 50, you've gained 16 pounds back, okay. Right? You know what I mean? That's not the end of the world. Part of that is because, our knees go bad, our hips go bad, and if you want that ice cream, okay, you know what I mean? Like, you'll have it.
You better lace them shoes first.
That's right. So Megan knows one of my rules.
Pay for it in advance,
Pay it in advance, baby. So that's one of my rules. That's so fun. Do you really do that?
Yes.
All right, tell everybody about that. I love that.
Okay, so we have a rule. He has a rule. I have a rule.
We have a rule.
That if you want something, you pay for in advance. So if you know that pint of ice cream that you want, if you're going to eat half of it, it's 150 calories, go run your ass a mile. Go run.
I love it. Yes. I love it.
And you pay it in advance. That way, you come home, you slide them shoes off, you take a shower, you eat and enjoy that ice cream, and guess what? You haven't gained any calories.
That's right.
Still at a deficit, doesn't matter.
That's right. Still at a deficit. I'm at a deficit.
Right. I'm at a 2,100 calorie deficit.
That's right.
Let me teach you.
And you could teach a class on this.
I could.
But you're so right. So I have this thing about living with regret. So you do this, you're in this business long enough and you start thinking about things like, how do you really impact people in the long run, right? Because surgery, I can do, you can do, we can do, low complication rates. How do you win in the end? Like, how do you get where you want to go, right? And then you learn the tricks, right? And some of the tricks are, okay, like, what if I just set up some rules? Like, I can't have 20 rules because nobody can follow that. No. Nobody can do that. You just need a few simple rules, right? Like, I eat 3 times a day. That's it. There is no snacking, right? Yep. Like, snackings are a figment of our imagination. They're gone. 2, you can eat as much as you want at any of those meals. Absolutely, as much as you want. However,
as much as your restrictions
allow. That's right. So that's the secret, right?
Not as much as you want some days, but as much as your restriction will allow.
And so what you tell people, though, is you can eat as much as you want. Go nuts. You can't eat that much. That's the tool you've been given, right? The tool. So if you use it right, I eat 3 times a day, and I can eat as much as I want, which isn't much. Rule number 3, you have to start that meal with protein. Yep. And if you start the meal with protein, whether I ate my chicken or my fish or my protein shake or whatever, how much more room you think you got for that chocolate cake, right?
Not all that.
Not much. And so then there's another rule, which is don't live life with regret, right? So you want that ice cream.
Damn right.
You go get it. You go get it. So here's the deal. You are not allowed to pay for that ice cream after.
Nope.
You can't walk out of the grocery store without paying for the food first. You know what I'm saying? That's great. I love it. So I say put on your running shoes, go earn 250 calories. When you come back, you take that shower, you sit down with that bowl of ice cream, and just enjoy it, no regrets. Mm-hmm. That's what's up. That's one. I love that. You remember that. That's so great. Okay, let's nail out some facts, and then let's talk about where you're going with your life. some facts. Like I'll ask you questions.
I'll answer.
Do you think it's true or false that if you get pregnant before 1 year after having weight loss surgery, that your fetus is in danger?
I would say true, but I've seen great stories.
Right.
So while there is a very serious risk that before a year that your malabsorption, especially with the bypass, with the sleeve it's a little different, and I know you know, sleeve it's a little different, you don't have to worry about the nutrition as much. But with the bypass, I think before a year you're in kind of treacherous territory you don't want to play with until you've got a little bit more room in that pouch for nutrition to be in.
For some love, some love.
You do, because I've seen some bad stories, you know, fetal underdevelopment and having to deliver early because of fetal underdevelopment. And being a part of that community that I'm in right now for fertility and infertility before and after gastric bypass. We have a group on Facebook if you'd like to follow us. Hello. That we kind of share our stories, and there's always a post pretty much every day. It was my turn today. And there's always a baby announcement. There's always a pregnancy announcement, and it's wonderful support. But please speak to your doctors, talk to your RDs. Like,
oh, sure, 100%.
Always.
Everybody's got to be on board.
Everybody.
And if your OB doesn't know a lot about weight loss surgery, it's okay. Help them admit that, and then let's get them educated. Yeah, let's get a phone call. So the answer to that question is actually, let me preemptively say that it is recommended that you wait at least 12 months. We really would love you to wait 18 months so that your weight is completely stable before you get pregnant. Yep. That would be the safest for everybody. Plus, as I say to all my patients, this is your year. This is your selfish year. This is about you and your journey. Nothing wrong with having babies, but like then it would be about y'all. And this year's about you. Having said that, the recommendation is to wait at least a year, hopefully 18 months before you get pregnant. Yep. But I will tell you, in almost all the studies, they've actually shown no significant risk to the baby if you get pregnant before. So if you do, here's the deal. You need to know and you need to tell somebody. Yep. And we're going to change your diet, right? As you know, liquid calories you can pack them on, right? Yep. And we'll go to 7 small meals a day and we'll do whatever it takes, but the safety of the baby is then the concern, right? Yep.
You really have to watch your nutrition.
All right, good answer. Okay, ready? Number 2. Let's see. You are at higher risk for complications at birth if you've had weight loss surgery. False, you're right.
100% false.
Absolutely.
There's nothing wrong.
Okay, you're right. True or false? You have a higher risk of having a C-section if you've had a weight loss surgery.
False.
It's true.
Nuh-uh.
That one's true.
No way.
That one's true. I wonder if it's because you're getting a free paniculectomy out of it. I just wonder if that's where we're going with that. But that's actually true. That is one of the only, they call it a risk, but it's not really a risk. I think people are due a planned C-section.
Well, I would think so. If you've had any kind of weight loss surgery, they're really monitoring fetal development. And like I said, some of them are taken weeks early because of that. They just stop growing. Right. And that's kind of becoming a trend in that group. They're about 34 to 36 weeks. Right. Is kind of where they're sitting at right now. But I hadn't seen a C-section there.
I know.
Normal delivery.
You know, what's really interesting is people are always talking about the risks to the baby and mom after weight loss surgery, or if you've did it before 12 months. What nobody ever talks about is what is the risks to the baby if you're pregnant and obese?
True.
Significantly more, right? Like the diabetes, the oversized babies, the babies who weigh too much.
Right, 10-pound babies.
Oh yeah, 10 pounds, 10 plus. 10 plus. So there's actually a significant risk of being pregnant while obese that is offset completely after you lose the weight. All right, now you are more fertile if you've had weight loss surgery. True or false?
True.
True. Definitely true.
Hands down, being overweight does impede your hormones, which kind of shuts down your reproductive system. Your body won't physically allow you to reproduce. In some cases, that was my problem. My body was not allowing me to physically reproduce because I was overweight. They were like, no, you need to get yourself in check first. No,
Absolutely. You know, it's funny you say that. So it actually goes on both sides. You can be too skinny, right?
Absolutely.
And those girls were the girls who were super athletes, super skinny, and like couldn't have their periods at all, right?
0% body fat.
That's right.
Yeah,
Yeah,
no
it's not
periods.
good.
Yeah.
Then there's the over, right? So there's two places you can get estrogen. One is your ovaries, and the other is excess fat in our bodies.
Fat cells is where
That's
it's all
right.
stored.
That's right. And so that overabundance of estrogen stops you from ovulating, and that makes you not so fertile. So yes, you're right. Okay, now let's you and I switch gears, and let's answer a couple questions coming from online.
Gotcha.
And then I think we'll wrap it up. Question: what about if I'm 62, not wanting to have babies? Is my age a problem for weight loss surgery? What do you think?
Absolutely not.
Absolutely not. Absolutely not.
Better now than never.
That's right.
Sooner rather than later.
That's
Told
right.
you that's my only
5 years
regret.
ago.
Do it right now. Right now. Come see us.
Come see us, please. I will tell. Yeah, and you'll see your picture on the way. Have you seen your
I
picture?
did.
Aww.
I did. Jessica sent it to me and I cried. I was like, oh
Aww,
my gosh.
that's wonderful.
I could not believe it.
It's amazing, amazing.
Oh.
I would tell you 62 is so age is just a number, period. I have actually operated at 78, I think maybe 1 over 80. This is a woman who came in, she's like 78, and she's like swims 68 laps a day, like she was an animal. And she looked at me, she goes, I know exactly what I'm doing. I'm 78 years old, and if I stick myself with one more insulin needle, I'm gonna scream. Are you gonna do my surgery or not? I was like,
Yes, ma'am.
yes, ma'am. Yes, ma'am, I will. Thank you very much.
Right over here.
All right, what about loose skin after surgery? I'm gonna let you field this one. What do you think?
So, with any person that's with excess weight is going to come excess skin. Just depends on how quickly you lose the weight is how quickly your skin kind of shrinks back and kind of gains that elasticity back. With gastric bypass patients and sleeve patients, we tend to lose weight a little quicker, so we do have a little more excess skin. While some are more excessive than others, a lot are still manageable. A lot of women who have had children end up with like a mother's apron. We call it like the mommy pouch or the fupa or whatever you want to call it.
The fupa.
The
You just said the fupa.
Yeah,
You just said that.
On Facebook. On Facebook Live.
I'm gonna need some more water, folks. This is getting hot. All right.
But that's typically what we end up with. We have angel wings or.
Did you find like there was a product you could use that helped with loose skin or anything or?
I don't suffer that bad.
Good.
So I wear a tank top or a cami if I'm feeling super insecure about a shirt, but not with this 12 glass of
That's
water.
right. That's right. And you should be proud of that.
And I think everyone should embrace the body that they're given and the life that they're given after gastric bypass or sleeve surgery, because who cares about skin? You have your health and the rest of your life to live for.
That is very true.
If you get rid of the excess skin, then...
And that is so true. The only caveat I would say is that I tell people, if you earned it, you do whatever the heck you want with your money.
Yeah, absolutely.
You know what? That's your money. You do whatever if it makes you feel better to tuck that off. Plus, there are some elements of pain and restriction, like loose skin causes, like I got this rash or like there's this pain. So like there's an element to that. But you're right. Celebrate your health first. Everything else is just candy, right? It's
everything
just candy
else is
on top.
icing on the cake.
Icing on the cake.
Candy in the bowl,
I agree.
whatever you want to call it.
I will tell you, and I don't usually do plugs, but I will say there's some really good stuff out there for anyone getting pregnant or anyone who's losing weight. I'll just say my wife doesn't mind me telling you this. So Mother's Special Blend. Could be secret blend. I think it's special. Anyway, it's like when people say, I put cocoa butter on and I didn't get any stretch marks. That stuff is amazing. That stuff is insane. Like you don't get any stretch marks. You don't get this, you don't get that. You're right about how rapidly you lose the weight. I would also add in there, age is something to do with it too, because
absolutely.
It's like a 20-year-old gets pregnant and like 2 weeks later, they're like, and you're like, whoa, how'd
They
you
were
do
never
that?
pregnant.
They were never pregnant, right?
Never pregnant.
A 40-year-old gets pregnant, it's a little bit different. And you can imagine 50 and 60, it's a little tougher. Our skin loses that elasticity.
Very quickly, yeah.
But take care of your skin, keep working out hard. You can tone most of that. And anything else, if you don't, if you're not happy with it, it's up to you. Go get it talked. What else we got? Does being obese affect hormone levels? Oh my gosh, yes. After surgery, oh my God, that's a huge question.
That's the number one.
The answer is yes.
All the time.
And how will it change? Theoretically, if you get back to a BMI that is within that normal limit, your hormones will go back to a normal level. That is theoretically what will happen. So
That's exactly what happened to me.
100%. Okay, will my menstruation change after surgery? Yes. That is a great question.
It'll come back.
I don't menstruate, so
Like
you want to
yours.
take this one?
Sure.
It
It took me about 3 months after surgery to really, I was just under 300 pounds 3 months after surgery, and my menstruation came back, and I was like, oh no, what's happening?
like you didn't have menstruation?
Up until I
Wow.
had surgery, I had not had a period and couldn't tell you how long, was literally on fertility drugs to get pregnant, and just wasn't having that normal cycle. So having that come back, it came back normal. It's not like it came back in full force or it was absolutely excruciating, but it did come back.
Right.
And
Now, could you tell you were ovulating? I mean, can you?
Yep, you can
Yeah.
feel that you're ovulating. You get those cramps back. If it's almost like, I was like, oh wow, this
That's
is
wonderful,
It's
though.
kind of like I'm 15 again going through
Yeah.
this, and I was like, wait
Whoa.
a second, what do I do? I haven't had one in so long. Where do I go? I need a mom. Someone.
That's awesome.
someone
Mom.
Hi, mom.
oh, hi,
Hi,
Mom. I'm sorry, you beat me to it. Oh my gosh, I can't believe I did that.
Gotcha.
Okay, how long does surgery take? How long will I have to work off? So surgery takes anywhere from literally 30, 40 minutes to an hour and 15 on average. So that's between a sleeve and a bypass. That's just for them.
I woke up and I went in and woke up an hour later in recovery.
There you
Literally
go.
looked at the clock and it was 1. I was like,
And you were
oh,
bypassed at
I was bypassed.
367. So yeah,
was
so that
quick.
was different. How long should we use birth control after surgery? Again, my thoughts are
for as long
at
as
least
you are
that's
sexually
right.
active.
That's right. For a full year,
Yeah.
hopefully maybe 18 months. I mean, it just depends on how fast you want to have babies too.
Yep.
But I think as long as you and I get the message across that you become fertile myrtle, if you don't want to have babies, you better be on birth control.
Yep.
Right? Okay, so let's get back to you.
Okay. I asked you at a year when I was 185.
That's right.
And you
So
said,
where are we at with that? Where are we going with this?
So, we are not actively trying to get pregnant because I am thoroughly enjoying this, taking this thing for a test drive because she does things that she couldn't do at 360, but then she, is doing things that she was doing at 360. So hey.
Since middle school. Like, when was the last time you weighed 150, 160?
Middle school.
Middle school.
Yeah, because doing weightlifting in high school, I packed on probably 40 pounds. I also had an autoimmune deficiency, so I got diagnosed with ITP at 12
Ooh.
and was put on
Steroids. Yes, you were.
And buddy,
That's a big
she
deal.
was
Yeah, you
jacked.
bucked up. You bucked up.
I
Which
did.
is great though, because you show that you could do that. You can lose this. It's not a problem. Do you feel like you can pack on muscle now? Like
I
you
can.
Good.
I actually can.
Yeah, because people will say, "Oh, you can't get enough protein in. You can't do that." That is not true.
It's not true.
Not true.
I might be at a caloric deficit, but my body is not at a protein deficit.
Absolutely.
This hair ain't gone nowhere, but
That's
I cut it
right.
off
That's right.
myself.
It's 100%. Now you used to have long hair.
It was all the way down to my butt.
Yep.
cut it
And
off.
so do you cut it because it was just unhealthy? You felt like you needed to.
No, I was like, okay, I've revamped my look. I got rid of my old wardrobe. I cut my hair,
All great advice, by the way. Get rid of those old clothes.
Oh my gosh.
Get rid of them.
There's also a page on Facebook that we do like a gastric surgery trade. So if you've got older clothes that you want to get rid of, you can
that's
donate
awesome.
them. And if you're, in a size and you need a size smaller, there's people that are always posting stuff. So
That's
and
called
it's free
free
to do.
shopping.
Exactly.
That's free shopping, people. You need to yourself. You need to follow her, and she will post these things for you. So this is wonderful.
Follow me and I'll show you the ways.
All right, so you haven't removed the goalie yet, or whatever they say.
No.
Okay.
So we're
But
doing
will you
good
let
with
us
it.
know if that?
Absolutely.
Are we planning on that someday?
We are. So I know we had a discussion at my 18 months, and I said, should I do plastics before I have a child?
Ooh.
Before I get pregnant again? Because
That's a good question.
Twins run in his family. We were pregnant with triplets, but we were.
You were on Clomid.
I was on Clomid, so. Which we welcome multiples. That would be great.
Go for it. Just get it done.
One and done.
Just one and done. I got twins.
So it's in the near future, but I don't know how long I want to enjoy this body, or if I want to tuck it and then have a child, because I've seen in our posts.
And what did I say? What did I say? Because I know my answer.
Do what you want to do.
Do what you want to do. I would never say that.
No,
I'm
you didn't
kidding.
say that.
I would say, no, to you I would say do what you want to do.
Have children and then get your dream body.
That's right.
That's exactly what he said to me. But I kind of want my dream body for my husband for a little bit, just to have that,
So I only say this because it's much more arduous of a task to do a redo.
Yeah.
Right. If you're gonna have babies, it's a personal thing. I would tell you, do it, then go get the mommy makeover. You see what I'm saying? Because you can easily grow into this. If you have a really good abdominoplasty done and you're tight as tight can be, you're gonna end up spreading those muscles out and that skin again, and then this perfect skin that they've pulled tight and beautiful, and you're so happy, it's gonna get stretched again. And not just this. These get engorged and then they deflate, and so there's just a lot to that. I would say I would wait.
Yep.
However, there's no shame in either way, right? What are you gonna do? So I would tell you.
And the deciding factor of me saying that I would wait is because I wanted to breastfeed, and I know getting an augmentation and a lift would.
It can hurt those chances.
Yeah.
Not 100%, but it can hurt those chances.
Right, and I didn't want to take that chance because my son didn't breastfeed. He wouldn't latch as an infant, as a newborn would not, and it broke my heart. And I thought I was the worst mom in the world, and I was like, I'm young and I don't know what I'm doing. So I want that experience.
I know that feeling. Like and I'm not even a woman. I know that feeling. I watched my wife go through it. It was tough. Actually, that was one of the questions: is does weight loss surgery affect breastfeeding? And no, it doesn't. No, it doesn't. No, you are absolutely good to go there. Yeah. I've had so much fun.
Me too.
Will you do me a favor? Sure. Pinky promise that if and when you do get pregnant or plastic surgery, that you'll take us through some of that, like that story and that experience. Just because I think people want to hear about it, want to know about it. So that would be fun.
I'm so happy for her. She's actually a part of our gastric bypass.
Oh, Cheyenne?
Yeah,
oh, that's
Cheyenne.
Wonderful. Yeah.
She actually reached out to me. Like, I posted the little billboard, and she was like, oh, I got my surgery done there. I was like, by Radecke. She goes, oh my gosh, yes.
That's so wonderful.
So we became little Facebook friends, and I saw when she posted, I was so
I'm really
happy
excited for her.
I know that was one of her struggles and a reason why she did as well. So
it was, and that's I'm really happy for her. I'm happy for all you guys. You kidding me? This is it. I know we started the segment with this, but it just the truth. I'll just echo it. This is why I love my job. You're why I love my job. So I can't thank you enough for taking the time to drive all the way over here from Tallahassee and getting a hotel and doing the whole shindig.
Of course.
But
anytime.
We just love it, and thank you. Facebook thanks you.
Thank you
for all the staff here tonight helping us out with this, and God bless you and have a good night.
Good night.
Bye, Mom.